Hey, this is Dr. Caudill Miller with Dr. Miller's Guide to Neurology. We've been talking about headaches lately, and today we're going to talk about cluster migraines. I've mentioned this briefly before, but clusters come in clusters. You had a patient, one time he had headaches 3 o'clock every day for 2 weeks. And then I saw him about 14 months later, 3 o'clock every day for 2 weeks. Then about 2 years later, 3 o'clock every day for 2 weeks. So they come in cycles or clusters. The character of these are very similar to a migraine, but they're always sort of retroorbital behind the eye. They can move a little bit. You can have increased watering of the eye or lacrimation of the eye. Your nose can stop up or run. You can have a small pupil on that side. Your eye can droop, what we call ptosis on that side. Have some facial redness or some sweating on that side. And these are severe headaches, just about as bad as a migraine gets. Nausea, vomiting, photophobia, just unbearable. So when we see a patient with clusters, we're sort of in this panic because we know they have 2 weeks. They're going to have headaches every day, or 4 weeks, some of them several months. And we've got to break this cycle. So what do? So the first option are the TRIPTANS, and once they came out, they have really helped a lot. We'll use Imitrex, or Maxalt first line, Relpax, Zomig. Love the long actings if you can get them, like Frova or Emerge, 1 twice a day with some Anaprox DS. We also have an option they're unbearable to put in the emergency room, give them DHE 45, 1 milligram every 8 hours, with some Reglan or antiemetic, for 1 to 3 days. TRUDHESA nasal spray is new. I haven't really used it in cluster, but definitely would be worth a try. Home oxygen works great for people. Sometimes it's hard to get this set up, but by the time the cluster's over, you still haven't got it set up, and once you set it up, they have it at home. Another thing I do with just about everything, I'll give them prednisone. If they can take prednisone, I'll give them 60 to 80 milligrams a day, and then every other day drop 10 milligrams. So like 60, 60, 50, 50, 40, 40, 30, 30 till they're off, which takes about 14 or 15 days. The new CRGP monoclonal antibodies, Nurtec and Reveille we've used. Nurtec can be used for maintenance now, so you can try that. Rayval is another option. So there's a lot of things you can try. But this is the type of patient you got to communicate with almost every day because they're going to have 2 to 4 weeks of hell. And we've got to break that cycle. So that's cluster migraine. So subscribe to my channel, like my channel, make any comments, and more later.